But today I wanted to kind of talk to you about the hormones and health. We have got so many people that we are actually working with right now, and they feel like they're making the right choices. You know, they're drinking the diet sodas, they're doing granola bars instead of candy bars, and and Reese, when I came on, I heard you talking about the sugar and everything, and that has been such a big deal. Like our whole entire world is just filled with sugar, 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 and people come in thinking that they're making the healthy choices, but they're not. I just listened to a podcast actually this morning, and it was talking about Ozempic, and they were actually talking about kids and how obese they were. And so this doctor was actually talking about a 6-year-old child who they were putting on Ozempic. And I kept on thinking, when you have a dirty fish tank, do you clean the tank or do you drug the fish? And so we really need to get to the point where we start, looking at the lifestyle modifications instead of just throwing drugs that have so many negative side effects to it. And that's one of the reasons why I absolutely love our Slenderize drops. Okay. So today I'm just really going to kind of talk to you about some of the major hormones that can affect your weight. The drops here, they help to balance your hormones. So it's going to help to balance your hormones with your insulin, which is going to help regulate your blood sugars, your thyroid hormones, which regulates your metabolism, the cortisol hormones that regulates your stress. We're all dealing with stress right now. Sex hormones, that would be like too much estrogen or not enough testosterone. But excess insulin is like a fat cell fertilizer. So you really need to look at like what is your diet like right now? How many processed foods are you eating? Are you eating a lot of starches, the carbs, the soft drinks, the Starbucks coffee that so many people are hooked on? It's just full of sugar, sugar, sugar. And we don't think about it because that's all that we see in society. We don't know anymore what a good decision is and a bad decision is when it comes to our foods. So when people get onto the Slenderized drops, of course, we have the food list that is on there. And all those foods are low glycemic and they're also anti-inflammatory. So they're not elevating your blood sugars, which is huge in helping to heal the body, of course. Insulin resistant symptoms. You've got muscle loss, belly fat. When I think of belly fat, I really think of it like my husband used to make fun of me because we would go to the beach and I have a scale that would actually measure the visceral fat. And I had gotten so used to measuring people's visceral fat that I could have a guy walk across me and I would sit there and I'd say 15, 20, and I wasn't rating them on a scale of 1 to 10. I was actually looking at their visceral fat and I had gotten to the point where I could tell. But inflammation, rapidly aging. I've run into so many people that actually graduated with high school, and I'll look at my husband, he's 5 years older than I am, and I'm like, do I look that old? But again, that's insulin resistance, high blood pressure, high cholesterol, high triglycerides, a poor sex drive. All of those things actually go in with the insulin. And a lot of people do not realize that 1 in 3 Americans right now are actually considered pre-diabetic. Type 2 diabetes is both preventable and reversible. Dr. Strand told me that 10 years ago, and I honestly thought he was crazy. By that time, I've been a nurse since 1998, and he was the first doctor that told me that you could actually reverse type 2, not type 1, but type 2 diabetes. And I thought, no, there's no way. I'd never seen a patient reverse their diabetes. When we got them started on the Slenderized drops, when they started following the food diet or the food list that's on there, the first time I saw somebody have an A1C go from 13.9 to 9, and then within the following months, it was gone to 7, it went down to 5.6. And I thought, wow, that really did happen. And so I was excited about that. And that's really where my journey kind of started. But then I saw someone else do it, and I saw someone else do it, and I saw someone else do it. And I thought, you really can reverse type 2 diabetes. So if you know anyone, if you yourself are pre-diabetic, and you do not get it under control, you will probably have full-blown diabetes within 5 years. And when that happens, you're automatically at an increased risk of strokes, cancer, heart disease, all the things that you do not want to have to deal with. And then thyroid, your thyroid hormones, that's another big issue when it comes to gaining weight or not being able to release weight. So hypothyroidism affects 1 in 5 women and 1 in 10 men. And in over half of the cases, the conditions are not actually diagnosed. Now, a common cause of hypothyroidism is actually gluten. So think about your cereal, your crackers, your bread, your beer, the pasta that, is in the standard American diet that people are eating all the time. So all of this is affecting your thyroid. There is actually a few other things that you can do as far as your foods are concerned when it comes to eating correctly, if you have a thyroid issue. So avoiding soybeans or soy. So soy and corn are going to be two of the most genetically modified foods out there. And soy, it literally, it mimics estrogen in the body, okay? But then we talk about raw vegetables like broccoli, Brussels sprouts, cabbage, cauliflower, kale. All of those are really, really good for your health, for your diet and everything else. But if someone has thyroid issues, they need to actually eat those cooked because the raw contain the thyroid blocking compounds called the goitrogens. So if you do have a thyroid issue, pay attention to which foods you are actually adding into your diet. You can also do like wild caught low mercury fish, seaweed for the additional iodine. You can do pumpkin seeds or pepitas. That's going to have a lot of zinc in it. Oysters have got zinc in it. Brazil nuts, it's got the selenium, the iodine. So those are all really good for your thyroid. There's quality supplements that you can use for your thyroid health. And that would be a really good multivitamin, which, we've got our optimals. You couldn't ask for better vitamins than what we have. You have the fish oil, so we have the omega Q. You have the Magna Cal D, which is going to have your magnesium, your calcium, your vitamin D. All of these are going to help support the the cellular nutrition for your body. Now, this is a picture of my my great-grandfather, my favorite great-grandfather. This is Ken Bailey. And I started thinking about cortisol. So one of the things that the Slenderize drops do is it helps to balance your cortisol levels. And when I think of cortisol levels, I think of stress. So if Ken Bailey is out there and he is hunting for a bear and this bear turns around and starts to chase him, Ken, tell me how you're going to feel.
How am I going to feel? I'm hoping I can outrun that bear. And if any of my buddies are with me, all I got to do is outrun them.
That's right, because they're going to get them. Okay. So, but when you are under, immediate stress, then, or the short-term stress, things are going to happen to your body where you end up running faster. You're going to see further. You're going to hear better. You're going to have that quick energy. It's boom, boom, boom. It's basically the hormone that helps you to survive danger. But if you have chronic stress, it actually slows down your digestion and your metabolism. So short-term stress, fine. But when you start having that chronic stress, it slows everything down. And so it makes it harder for you to be able to release weight. I personally do not need to release any more weight. I still take the drops. I'm taking the drops daily because I feel like I'm going through a lot of stress right now. And between Jesus prayer and the drops, those are the three things that are keeping me balanced. My chronic stress would be, I've got 3 kids, I have 3 jobs, I have a mom that is in her late stages of Lou Gehrig's disease that I'm helping to take care of. And all this adds up. And when we have that chronic stress, it does take a toll on your body. And making sure that you're continuing to get that good, healthy nutrition is really going to help your body healthy. And all that good stuff. But when you do have that chronic stress, it can lead to high blood sugars, the increased belly fat, the high blood pressure, high cholesterol, the muscle loss. It all goes together. It all compacts together. And then here's the other big one, the sex hormone imbalances. So too much estrogen can cause weight gain in both men and women. And yes, men do have estrogen in their body. But a lot of times our diets, again, will affect our hormones. So too much sugar, the refined carbs, alcohol, all of that is going to cause an imbalance with your hormones. Again, the soy is going to mimic the estrogen in the body. So, how do you know if your hormones are out of whack? For women, breast tenderness, fluid retention, fibroids, heavy menstrual bleeding, bad PMS. Men, they can have too much estrogen. If they do, they're going to have too low testosterone. So, they would notice maybe loss of body hair, a beer belly, man boobs, losing muscle, gaining fat, low sex drive, fatigue, mental fog. So men, yes, they can have issues with their hormones too. Um, Another reason why I absolutely love our drops is because everybody needs them. If you go to Walmart right now, you're going to either find people who need to release weight, or if they have hormones in their body, they're guaranteed they're going to be out of whack. So this is something that we all need. There are ways, lifestyle wise, that will help you to reset your hormones. Practice relaxing, meditation, exercising, all that good stuff, making time for relationships. A lot of times, our only relationship that we have is with our cell phone. But put up the cell phone sometimes and just spend time with your friends, your family. Eating the hormone balancing diet, follow that food list. That food list is there for a reason. It all has benefits. Bulking up on fiber. In my studies, I have found that normally 5 grams of fiber was the average amount of fiber that Americans were getting, and that was 10 years ago. So it's probably in less than that now. But I like to have people get like 30 grams of fiber a day, which is basically 8 to 10 servings of vegetables and fruits. I like to limit the fruits, about after 1 o'clock. I don't recommend anybody doing fruits after that because of the blood sugars. Pooping daily. That's something that people do not like to talk about, but it's very important. And so, if you're having issues with constipation, using things like smooth move tea would be good. The unrefined coconut oil is a natural laxative. Using Magna-Cal D, because a lot of people do not realize that they actually have a magnesium deficiency if they have issues with constipation. You could use the Giving Greens, the probiotics, or you've got the Pure Nourish shakes. Any of those things that's going to help with gut health is going to help with the constipation. Making sure that you drink enough water. So I always recommend people drink half of their body weight in ounces of water daily. Removing alcohol from the diet, that is key. That alcohol is going to cause inflammation. It's going to raise the blood sugars. All of that goes in together. And exercise. You don't have to do anything crazy. You don't have to do CrossFit and, run marathons. And if you like to do that, do it. But a lot of people are not in that stage of their life where they can do it. But can you go out and can you, just do a brisk walk, or can you take a hike, or can you go kayaking? Can you go dancing? The best exercise is going to be the one that you do. Okay. So again, here is the approved food list. Very, very important. You notice that the fruits are more limited, and that's because fruit has got more sugar in it naturally. So the fruits that are listed on here, those are going to be the ones that are not going to raise your blood sugars. It is important for people to get good, healthy fats. I always like to tell people, if you eat sugar, your body's going to burn sugar. If you eat fat, if you eliminate the sugars and you eat the healthy fats, your body's going to be burning the fat. But there's common hormone disruptors in our foods, and that would be your dairy, that would be sugar, soy, processed foods, your vegetable oils. Any of these things would actually disrupt your hormones. And that is one of the reasons why we have to take it out. That's what we have to do. So our body balancing drops, I know you all love them. I honestly, I'm going to be honest with you. Years ago, I did not use these on a lot of people. If I looked at someone and I saw that, they only needed to lose 5 or 10 pounds, I really wouldn't talk to them about the drops. And now I'm kicking in myself because now I realize it's so much more than just releasing weight. So we all need to help balance our hormones. It's great that the drops are going to help curb your appetite. So many women have told me that they have found that they have an increased energy during the day, but they're able to sleep at night, which is huge for a woman who cannot sleep. It's going to increase your metabolism. It's going to boost your mood. We're sending this stuff straight to the White House because they all need attitude adjustments. We have the drops are going to help support the thyroid, helps stabilize the blood sugar. And really and truly, if we can get that blood sugar stabilized, that's when everything really turns around. And how to take it. Okay, so you all know you've got two drops. Drop number one, that's your Slender X. You're going to take that one, take 0.7 milliliters 3 times a day before meals. This is the one that's going to help stabilize the blood sugars. It's going to help with hot flashes, night sweats, boost the mood, help curb the appetite, and it's going to help increase your metabolism. That drop is put underneath your tongue, and you're going to take that 3 times a day at breakfast, lunch, and dinner. 10 minutes later, you're going to take the Accelerate, and that is bottle number 2. And this one, you want to make sure that you shake it up, but you're going to take 1 milliliter twice a day. The B12 in this bottle is the same kind that you would get in an injection at the doctor's office. This is the one that helps with stress and anxiety and mood, helps with your energy level, decreases the cortisol levels. So they work synergistically together. And this one you're only going to take twice a day at breakfast and lunchtime. You don't want to take it at dinner. You do. If you have a to-do list, you let me know, and you'll get it done in the middle of the night for sure because of that extra energy that you're getting. But all of this works together. And I think that was it on there. But there's just so many health benefits, and we're seeing so many testimonies, not only with people releasing weight, but with people just feeling better. Their life is getting better. Their body is healing from the inside out.
Carrie, a lot of people run into individuals that are skeptical or maybe say something negative about the skinny drops. Will you talk a little bit about the 90 doctors in your area that refer their patients into your program?
So most of the time it starts out with someone who is doing the program. Our program is called the Next 56 Days. And they will go to the doctor's office. They're either on medications that, let's say they're diabetic. And of course, we do not change any of their medications, prescriptions. That's not for us to do. We don't give any medical advice. All we do is we teach a lifestyle, a healthy lifestyle. And normally they end up going to the doctor, and the doctor says, "What on earth are you doing?" And whatever you're doing, you make sure you keep on doing it. But the proof is always in the blood work. The patients come in there, they find that their A1Cs have lowered, their blood pressure has gotten lower. So it's just proof again that if you can change the lifestyle, like lifestyle, food and exercise should be phase one when it comes to treating. But I found even as a nurse, like we didn't have time to see patients. Like we would put people in and take them out, and everybody was supposed to get 15 minutes unless you were double booked or triple booked, and now everybody's down to 5 minutes, and there's just no way that you can teach someone what they need to be doing. There's just so much conflicting information out there, and then you have companies that are telling you a certain food is a healthy choice or a diet drink is better when it's not. It's actually killing them. So we have a lot of doctors in this area who are definitely referring their patients to us.